Should I bend my knee if I have a torn meniscus? The short answer is yes, but there's a few important things you need to consider. I'm going to detail all this for you, but I need you to know right now that this is for situations where you have not had a meniscus surgery. If you have had a meniscus surgery, there's other information you need to be looking at, and this isn't the best video for you. So first off, let's answer the question of what happens to the meniscus when you bend your knee. So I've got my knee model here, and this bluish thing right here that I'm wiggling is the meniscus, and you have a pair in each side of the knee. And so you have 4 menisci total, 2 meniscus in each knee. When you bend your knee, the bones shift on each other like that, and it technically adds slightly more compression onto the meniscus, but it's actually the most compression when you're bending your knee while putting pressure on it, like when you go to kneel. And so if there's a tear on that meniscus and then you're putting pressure on it while bending it, then you're at high risk to irritate that torn meniscus even more. Now, what if my knee is stiff? The stiffness can be for a few reasons. The number one reason is going to be swelling, especially if you've just irritated your knee, if you just had a flare up and things swelled up, you're not going to be able to bend your knee very well. The second reason is if there's a shifted piece of the meniscus. The meniscus itself can shift around. It's actually kind of a flexible tissue. And so if it shifts in such a way that it blocks the way your knee is bending or straightening, that can also cause stiffness in the knee. And then the last reason, the third, is osteoarthritis. If the surfaces on the end of the thigh bone are osteoarthritic, that means they're no longer as smooth as they were before. And so that surface is going to rub against the meniscus. And there's a chance that if that bone is rough and the meniscus is torn, it's going to catch and not be able to move very well. The mechanics are going to be thrown off. In this situation, it's okay to bend the knee cautiously, making sure that you don't force anything. It should only be motion within what you can tolerate. I always tell people in this situation, don't force your knee to bend. If it wants to bend and you can get to about right there, whatever percentage it is for you, maybe 50%, 70 or 80% of what your knee can bend, see if you can just take it a teeny tiny bit more without causing pain, without irritating it, without doing anything that you're going to pay for later on, and just hang out there for a bit and then get out of there. And when I mean for a bit, 30 seconds to 60 seconds is enough. Hanging out there for 10 minutes, even just 5 minutes, it's usually too much because you're compressing the meniscus and it doesn't like that very much. You can only take small amounts before you got to back off. You're better off doing light, gradual stretches frequently throughout the day, and usually that's what gains you gradually more motion without irritating things. Now, what if my knee is locked and it just doesn't want to bend at all? In this situation, you might want to get with an expert. You might want to go see somebody in person. You might need to get an MRI. You need to see what's going on inside the knee or get some professional help so that they can tell you what's blocking your knee from moving. I highly recommend starting out with a specialist trained physical therapist like myself. I'm a manual physical therapist because manual physical therapists generally know how to feel what's going on through the outside of your body and potentially even loosen up the knee so that it bends more freely without having to get any invasive procedures done. And it tends to be very good feeling. It's not painful to go through a manual therapist treatment most of the time, depending on who you see. And if seeing a manual physical therapist just didn't work out for you, then you're probably going to have to talk to a surgeon, get an MRI, and you might have a surgical consult as well, where they look at the potential of removing anything that's obstructing the motion of your knee bending all the way, because there could be a flap of meniscus tissue that's blocking you, and if it doesn't move with hands-on techniques from a specialist like me, then it might need to be surgically removed. Now, this is truly rare where you have to go into that situation. I can tell you I've had many patients come into my clinic here where they're locked in their knee and I do hands-on work and it frees up, and as long as we do all the rest of the treatment, the rehabilitation for a torn meniscus, they end up healing and doing very well without ever having surgery. Now, if you do free up your knee motion, the question to ask is, how do I prevent this from coming back? How do I solve the root problem of my meniscus issue? Well, there's usually a root muscle imbalance that is causing too much compression through the knee joints, which is compressing the meniscus, and this muscle imbalance then eventually causes a tear to form in the meniscus. And if you can take that compression off and release the pressure in the joint, then you can give the meniscus a chance to heal and potentially take flaps out of the way naturally so that you can move freely and normally the rest of your life with your normal knee. Addressing that root muscle imbalance is a process. There's a lot to talk about. I go in depth exhaustively through that process in the knee meniscus recovery program. You can learn more about the knee meniscus recovery program through the link in the description below. In the description, you'll also find a link to the playlist for all our meniscus videos on our channel here. And if you happen to be watching this still and you had a meniscus surgery, then you're going to want to check out the playlist in there that says knee meniscus surgery help, because there's specific information for that too. Hey, thanks so much for watching. If you thought this video was helpful for you, please give us a thumbs up, and don't forget to subscribe and turn on your notification bell so that you don't miss out on any of the helpful videos we post each and every week. Thanks so much, and I'll see you in the next video. Bye-bye.